Nausea, brain fog, tingly skin, hallucinations, loss of appetite, and crippling anxiety. These are just a handful of the debilitating side effects that members of the Yoga for Migraine Facebook group reported experiencing just from their migraine medications. The meds that we take for migraine not only can cause nasty side effects, but often they don't improve our migraine symptoms in the first place. And that is just one reason why I'm presenting this talk today, why mind body approaches should be the first thing you try for migraine instead of the last. So I'll come to you today to explain which mind body strategies can be the most helpful for migraine, what some of the risks are on relying solely on medication to treat migraine, and why you should prioritize mind-body approaches sooner rather than later in your migraine journey. You'll understand why mind-body approaches are more effective and less woo-woo than you might think. Thank you all for joining me. This is Adrienne DeLorco. I'm the creator of Yoga for Migraine and Beyond Migraine, and I come to you every Wednesday at 2 p.m. Eastern in the Yoga for Migraine Facebook group with free wellness talks for migraine and yoga classes. So if you are joining me live, it's always great to see who's here. You can add hashtag live, or if you're watching the replay, hashtag replay. So most of my Beyond Migraine clients come to me after having tried all the things. They have failed nearly every medication and are quite desperate because all the things that they have tried have not helped. So let's talk about some of why we tend to rely solely on medication to treat migraine and what other options there are. I think in Western society, the risks of medication are undervalued. It's just how we treat medical conditions, health conditions. We go to the doctor and get medication. It's just part of our culture. We don't even really question it. So some of the risks of taking medication are kind of undervalued because that's just how it is. And then the benefits, I feel, for mind-body practices are often undervalued, and people don't understand all the wonderful things that you can enjoy when you do more mind-body practices. So here's some of the risks of solely relying on medication for migraine. And I want to just preface this by saying I also support the use of medication for migraine. I definitely take medication myself. I think that the risk is just only relying on that as your only way to treat migraine. That's where we have more challenges. So most of us have tried a zillion migraine meds. I've tried a couple dozen myself. First and foremost, the side effects can be more disabling, more debilitating than the migraine itself. And so we had a whole post in the Yoga for Migraine Facebook group about some of the worst side effects people received and what medications, and it's overwhelming. I mean, the things that people have endured to improve their migraine, all those things we mentioned, even hallucinations, worsening mental health, weight gain, weight loss, nausea, all those things, we tend to undervalue how hard that is for people to endure, and you're maybe worsening other health conditions when you take medication. So that can be challenging, or maybe even creating new health conditions that you didn't have before. So those risks are often downplayed when trying one medication after the next. Whether you're doing medication or maybe injections, like these things can be painful, they're not comfortable, and I find relying solely on medication to be more disempowering because you don't feel like there's something that you can do, that you have agency over. It's just trying to pop a pill, and then especially when those pills don't work or they stop working, then we feel really disempowered and feel hopeless. It can feel like we're on this never-ending roller coaster of trying one medication after the next and failing them. We feel like we're the failure when it's really the medications themselves are not the only thing that we need or really the best treatment for us. Often we have to try all the older medications that are generic before we get the medications that we need as well. And that's something that we've advocated for in Headache on the Hill this year, is the Safe Step Therapy Act, to have it, to make it easier for patients of all kinds to get the medication that their doctor wants to prescribe, even if it's the more expensive one, rather than having to fail first and fail a bunch of medications that give you unwanted side effects that can be really detrimental. And in the meantime, your migraine isn't any better. A lot of people with migraine really resent feeling like a guinea pig, like the only choices are to just try one medication and then try the next, and going on this seesaw of side effects with it. Medication can, especially for some of the newer drugs that supposedly are more effective, they can be incredibly expensive depending on your healthcare plan. It could be $600 to $1,000 for a month's supply. And then there's the ongoing insurance hassles that go with that, of trying to get things covered, or maybe something was covered for me for a long time and then one day the insurance company didn't cover it, and then you have to go through just all those hoops to get the medication that maybe helped a little bit. For a lot of people with migraine, they might find a medication that finally helps them, and for whatever reason, their medication just stops after a while. It stops working for them. I've heard this anecdotally a lot for people who have taken some of the newer anti-CGRP medications. So if you have had that experience, you're not alone. A lot of times you might get your hopes up and then something's working for a long time and then it stops working, or maybe your insurance doesn't cover it anymore. Then we have the risk, especially with migraine drugs like triptans or NSAIDs, that if we rely on them exclusively to treat our migraine, that increases our risk of medication adaptation headache, aka rebound headache. So that's frustrating. You might finally find something that helps, but then if you take it too much, then you have more risk of having more migraine frequency. So it's incredibly frustrating. One of my clients described it to me as feeling like she was just playing medication roulette. You know, is this one gonna work? What's the side effects gonna give me? You're just, trying to gamble and see if something helps. The benefits that obviously people enjoy, you might get lucky and find a medication that works and has tolerable or little side effects. So it can also be very easy, right, to pop a pill and feel better. And I'm lucky, I do have that experience oftentimes, like with my triptan medication, and I'm so grateful that I do have that. And for some of the older generic drugs, like they can be pretty inexpensive and affordable. It doesn't require you to change your life at all. You can just take a medication and, if you're lucky, feel better. But that's not always the case. As we know, most of the people that work with me have tried a zillion medications, have experienced multiple side effects, and then they're still not feeling better, and they're feeling hopeless that they won't ever feel better. So let's talk about what are some alternatives and why I suggest going more towards a mind-body route sooner rather than later. What are the mind-body approaches for migraine treatment that I'm talking about? I'm talking about ones where you are building skills that empower you to manage migraine more effectively. So some examples could be mindfulness-based stress reduction. This has a lot of evidence for multiple health conditions, but really taking the idea of mindfulness, meditation, being present in the present moment to help learn a skill, learn a way of thinking and being in the world that is better for your health. Other modalities are cognitive behavioral therapy, and that's a gold standard practice for anxiety, even migraine management. There's even a little subgenre of that where it's specific for CBT for chronic pain. So you're learning in CBT and cognitive behavioral therapy different ways to think about migraine, to respond differently to your pain, to your anxiety. So you're feeling empowered, that you're learning not just to go on default mode to react in a way that is actually unhealthy for you. So the modalities that I am certified in and definitely advocate are yoga and pain reprocessing therapy. So with yoga, there's not a whole lot of research on migraine in general, let alone yoga for migraine, but there have been a few studies, and the most recent study in 2020 showed that people who with episodic migraine who practice yoga 3 hours a week were able to decrease their symptoms by half and their medication use by about half. And that really created a model for me when creating my Beyond Migraine coaching program to help people practice yoga for migraine about 30 minutes a day, which ends up being about 3 hours a week, and have experienced significant benefit from that. The other practice, and so yoga being a full, one of the original mind-body practices where you are integrating not only your mind, but your body, your breath, the way you think about things. All of this ties together to help you deeply relax, but also a way to live differently in the world that is truer to your purpose, to help you feel more balanced. And then pain reprocessing therapy is another practice that I am certified in. And it's similar to cognitive behavioral therapy. This approach is really taking the ideas of pain psychology, helping people to change how they respond to their chronic pain. So it's specifically for people with chronic pain. They have had wonderful research on using this modality for chronic back pain, and I've heard that there is research in the works for showing how this is beneficial for migraine as well. And with this, you are practicing becoming more comfortable with your symptoms. You're learning to decrease your fear and anxiety about migraine and about life in general, so that your migraine, you're able to ride out migraine with less angst, with less desperation, and the less fear that we have about migraine, the better your symptoms get. So the common denominator with these practices I mentioned, mindfulness-based stress reduction, cognitive behavioral therapy, yoga, and pain reprocessing therapy, the common denominator is that it's all skill-based. This is all patient-led. You are learning how to do this, and you are learning how to intentionally relax. That's common for all of these. And you're learning how to change your perception of threat and danger. So there's this physical piece. You're using your breath to relax. You're using your body. You're using your mind to be able to relax, which is very good for migraine. And you're using some of these cognitive changes to help your brain not perceive threat as widespread. When we develop migraine, our brain is just more hypersensitive to triggers, aka threat, to what we see as danger. But threat and danger is your brain's opinion. And what's empowering to know is that with practice, you can change your brain's opinion of these threats and dangers. And so that's what's held in common with all of these things. It's giving you more choice on how you respond, how you see things, so that you can live in a way that it feels more empowering and you feel healthier, you have less symptoms, and you have less anxiety about your symptoms. What's also great about these mind-body practices is that they only have positive side effects in your life. Yoga especially, you can kind of see this as like this poly pill where practicing yoga regularly can have a positive impact on so many aspects of your life, on your mood, on your energy, on your ability to be physically active. There's not negative side effects for the vast majority of people who are practicing relaxation, mindfulness, yoga. There's not a threat that you're going to have tingly skin and immense fatigue and nausea. Like these are all things that you're going to have positive impact from. And I think that's often overlooked. These preventative lifestyle measures create a ripple effect throughout your whole body and mind to help you feel better. So specifically in my Beyond Migraine coaching program, we integrate pain reprocessing therapy. That's like that brain retraining. Yoga for migraine, which is my own special blend of relaxation-based yoga practices, and then also helping you to implement daily self-care habits that are recommended for migraine, whether that's consistent sleep, physical activity, stress reduction, all of these things. This is what creates the biggest impact on your migraine. It's never just one thing. It's never just one pill, and it's also never just one yoga pose. You have to have this multi-pronged approach to get the biggest impact on your migraine. But often people only start to explore these mind-body approaches when they've exhausted all the other meds. And I'm here to advocate for you listening, you're already interested, to start learning these skills sooner rather than later to save you from years of trying one medication after the next that give you terrible side effects, that cost a lot of money, that send you to the doctor constantly. Let's learn how to have skills to decrease our pain, increase our mood, help us be more physically active in this more comprehensive approach. So what my clients experience in Beyond Migraine, which we are starting a new cohort June 3rd, it's coming right up, and I will put the little link if you're interested in learning more about Beyond Migraine in the chat. I like to schedule a call with anyone interested just so I can learn more about your history and see if you would be a good candidate for this approach. So what people experience through Beyond Migraine when they are learning skills, whether it's yoga, pain reprocessing therapy, they are implementing daily self-care into their lives, they feel empowered. They feel like there is something that they personally can do to help their migraine be better, not just relying on medication. It also improves other health conditions. So often people feel like their anxiety has decreases. They are able to sleep better. It creates a positive momentum towards adding more healthy behaviors into their lives. So for many people that I work with, it's been a struggle to be physically active at all. And once people start practicing yoga, incredibly gentle yoga, they're starting to have a little more physical activity. Maybe they add walking in. And then this starts to snowball where they're feeling confident about exercise. They're not scared that it's going to trigger a migraine attack. And then the more exercise, the more physical activity you have in your life, that's one of the best indicators for health, is getting your physical activity. So this just starts to snowball and you're able to do more and more for yourself. All of this ultimately is decreasing your pain. And this is a preventative approach. Just like taking a preventative medication, you don't typically see the benefits until maybe 3 months later. And in the case of Beyond Migraine, it's typically within 8 weeks that people are starting to experience less pain. That then creates more of that virtuous cycle with less pain. They're able to take better care of themselves. They have more energy. All of this is improving your mental health, which we know with migraine is very precarious. Understandably, we experience more anxiety and depression the more symptoms we have. So it's kind of not only decreasing the pain, which improves the anxiety, but also working to decrease the anxiety, which decreases the pain. So we're going both ways. We're learning how to do both. And the more physical activity you have, that is been proven to help prevent not only migraine symptoms, but also to decrease mood disorders. As a result, you're sleeping better, you have more energy, and you're able to do more in your life. So this all starts to have this positive upward motion in your life where you feel more optimistic again. You're not losing hope because you don't feel like you're just failing one medication after the next and losing hope that anything is going to help. You are doing these things for yourself, practicing how you're changing your mindset, you're changing your physical body. And what's beautiful is that once you learn these skills, these things are going to benefit you the rest of your life. If you start to be more physically active and start walking every day or doing yoga, that's only going to benefit you for the rest of your life as you get older. And so it's preventing even more health conditions later on down the road. Often people might assume that doing some of these mind-body practices and learning them is more expensive than taking medication. And I want to just share a statistic that the annual total direct and indirect costs of migraine-related health services for a patient with chronic migraine in the US is between $8,500 and $9,500 a year, which is about $750 a month that people with chronic migraine are spending on their health care and on time, missed from work, less productive, whatever it is. So that's staggering. That is not a cheap fix. And my Beyond Migraine program is drastically less than $750 a month. And what's wonderful is that once you learn these skills and make these changes, they are with you. You don't need to keep buying them. You have it yourself to implement. Some of the challenges with doing more of these mind-body approaches is I do want to be clear that they are most successful as a preventative strategy for migraine rather than an acute one. So for a bad migraine attack, I'm going to reach for my triptan. I will still do some of these mind-body practices. I still might practice yoga nidra, but at that point, the benefit is, I believe, more the strength of the medication is going to outweigh the mind-body practice. The mind-body practice is going to help me get through it, but not at that point necessarily stop my pain. However, I think for prevention, I believe that the mind-body approaches that I mentioned have a leg up because there's not any negative side effects. This is something you can do on your own. But for a lot of people, making change, being open to making changes in your life, whether it's in how you think or how the behaviors you do every day, not everybody's ready for that. They want a quick fix. They want to be able to just pop a pill and not change their lives. And if that's the case, these mind-body approaches are going to be a little bit harder. You're going to feel more resistant to them. But if you're at a place in your life where you realize that you need to make some changes in your life more than just trying another medication, then these mind-body approaches are going to have a really important benefit for your overall health and preventative health overall, not even just migraine, but for a host of other health conditions. The other things that are a little trickier with doing some of these approaches is that it's hard to do on your own. There are some new apps now that are making all these things easier for everything, whether it's mindfulness-based stress reduction, for CBT, for yoga for migraine. I've got my own on-demand video programs with the Yoga for Migraine First Aid Kit. Pain reprocessing therapy has the Curable app. So it is totally possible to do these on your own. However, I think it is hard. It is hard to make changes by yourself when you are dealing with chronic pain, and not to beat yourself up for it. It's hard to be consistent. And so that's why I feel like what I do is so valuable, because I have a proven system, I have a step-by-step process and accountability support to help you be consistent in putting these things into place. It's like learning a musical instrument. Maybe you can learn, to play Twinkle Little Star on your own, but if you want to get good at something, you need a teacher and you need to practice it. And that's how I see my Beyond Migraine program. I am teaching you how to retrain your brain to be able to relax more deeply and to ultimately reduce your migraine symptoms as a result. So if you are interested in learning more about my Beyond Migraine program, you can leave a comment below. You can write coaching in the comments and I'll send you a message explaining how it works. Our next group starts June 3rd and we've got people already joining the program. I'm really excited for this summer group to begin to help you start your migraine journey with more self-care, with more of this preventative, integrative mind-body approach that gives you the reins. It puts you in the driver's seat to learn skills on how to decrease your migraine, how to cope with it, how to be more functional in a way that improves your health overall. So I'd love to hear, if you are listening in the replay or live, what's your biggest takeaway from hearing some of these options of why we might undervalue some of the risks of medication and also undervalue the benefits of the mind-body approaches. What have you tried that has been a complete failure, whether it's been medication, and what has been a struggle? Maybe you've tried some other mind-body approaches and it's been a struggle as well. So I'd love to hear your experience in the comments and feel free to reach out and ask me more on how to better manage your migraine, decrease your symptoms with a mind-body approach using yoga, pain reprocessing therapy, and daily self-care. Thank you all for listening. Bye-bye.